Food surveys, the individuals in India, unsurprisingly, that develop type 2 diabetes are the ones more likely to be having carbs, processed carbs, white refined cereals. That's rice, cereal is the problem. The amount of minutes you spend watching television is associated with your risk of diabetes. Diabetes, we know, is associated with heart risks, heart disease, strokes and things like that. What about pre-diabetes? Does that still carry the same risks?
No, so the reason we call it pre-diabetes,
in South Asian population, problems such as having a large waist circumference, having fatty liver, having high triglycerides and cholesterol levels all confer that same risk of diabetes.
Yeah, for the rest of the world, red meat intake is also a real risk for heart disease as well. So
what you can do to try and bring that blood sugar down. And today we're going to be talking about pre-diabetes. We'll cover what it is, how to manage it, and what it really means for people who have it. But first of all, I'm going to present a vignette. So another case of someone who may be in a position to think about this. So a 38-year-old gentleman goes in for a full body check. He's got an HbA1c of 6.0 when he gets his blood tests back. His doctor tells him his BMI is 23, and the piece of paper that he reads when he leaves the clinic says pre-diabetes, lifestyle modification advised. His mum is distraught. She is saying he's got diabetes now, it runs in the family, and he's destined to have heart disease. But his friends are less worried about it. They say, 6.0, that's nothing. Most Indians have an HbA1c of 6.0. So what is this gentleman facing? What is pre-diabetes? And then we'll dig into some of the detail here.
Well, I'm really glad that he's gone to have his full body check, health check at 38.
Yeah.
That means he's listening to us, right? Because at the top of the show, or the top of this podcast series, we were talking about how you need to bring that forward. If you're Indian, you need to have these checks earlier in your life. And the 38 is much earlier than many Indians get it done. So I'm happy he did that. So congratulations to him. Thanks for getting it done. The next thing is he needs to understand what HbA1c is. That's a blood test that basically shows how much sugar has been floating around your blood over the past 3 months. Diabetes is where the body's ability to regulate sugar is broken. And so the sugar levels in your blood go high, and little bits of sugar can stick onto different bits of the body, stick onto the blood vessels, stick onto the heart arteries, can stick onto the kidneys. But the area where we measure it is when it sticks onto the blood cells. And so the amount of a specific protein on the blood that's got sugar stuck to it, that's HbA1c, right? So everybody's got a bit of sugar on those proteins, but the percentage is different for each person. And the level at which we set that percentage tells you whether you've got full-on diabetes or whether you've got no diabetes or whether you've got this thing called pre-diabetes.
And previously, we used to measure the amount of sugar in the blood, but that's not as good a marker of diabetes risk, because if you've just had a big meal, if you've just had a snack, you can still have blood sugar lingering around your body. So a single check of your blood sugar level is not necessarily a good marker of whether you've got diabetes or not, because it may over-predict it or under-predict it. Whereas what you're saying is that this HbA1c measurement is much more stable in the blood, and so it stays the same throughout the day, and so it's a much more stable predictor of diabetes.
Well, it stays the same for almost 3 months, right? So it's like a kind of check of how you've been over the past 3 months in terms of your body's sugar. If you have a blood test with high sugar above a certain threshold, a one-off with just a sugar level, you can make the diagnosis of diabetes quite confidently with that one-off, even if it's a single blood test. But it's just, if you don't have your blood test immediately after dinner and you just happen to have it at a time when your sugars are kind of looking normal, you might miss some people who over 3 months are adding the risks of diabetes. So it's important to kind of ensure that you haven't missed people. That's why it's such a good test.
I guess if you're going to go to your doctor for a blood test, you're not going to have a donut that morning.
Well,
right?
It depends
so
on what you
want. You might be asking it. But let's talk about it. So diabetes, we know, is associated with heart risks, heart disease, strokes and things like that. What about pre-diabetes? Does that still carry the same risks?
No. So the reason we call it pre-diabetes is because it is an area where people who over their life, their sugar levels are creeping up, but they haven't yet tipped over into the place where we know they're at higher risk of kidneys, eyes, heart and brain disease, like strokes. And also they're in a position to do something about it. It's potential to be reversed.
Okay.
So it doesn't in and of itself carry the requirement to have treatments or drugs or things like that. But it is a warning shot, I think, that it may be that in the future diabetes with all of its horrible complications is coming. And that's why we look for it, right? Because we can do something about this at a young age. I'm really glad that this guy's found it because we can improve his life. But equally, at this point in time, staying at this level of sugar is less well associated with bad disease than when he flips over into the diabetic categories.
Yeah, and the reality is the definitions and thresholds for pre-diabetes are derived from Caucasian populations. And so we know that people, when they reach those blood sugars, those HbA1c levels, they're at risk of developing diabetes. But unfortunately for Indians, that risk is there even if they don't have those HbA1c levels, which seems to be a theme of this podcast. We know from the Masala study, which I've said in previous episodes, the mediators of atherosclerosis in South Asians in America study that even individuals with a normal HbA1c are still at a very high risk compared to Caucasian individuals with other risk factors of diabetes. So just because you don't have pre-diabetes doesn't mean that you can ignore this. We know that in South Asian population, problems such as having a large waist circumference, having fatty liver, having high triglycerides and cholesterol levels all confer that same risk of diabetes, even without that HbA1.
Eventually, that number, that blood sugar level number and the HbA1c number will go up if you're going to get diabetes. Not everyone gets it. It's important to note that you could hang around in the pre-diabetic range your entire life. Okay. It's a bit irritating because you keep getting told you need to do something about it. But many people progress through to proper diabetes, and that's kind of what we want to avoid. I guess there's another environment where you might find this, or even just find that you've got a diagnosis of true diabetes for a short period of time, which is during pregnancy. So there's this concept of gestational diabetes that, of course, can only happen to pregnant women because they have to be pregnant to get it, where diabetes and your future risk of diabetes is unmasked in some way due to the stress of the pregnancy on the body. And those women have a high risk of future conversion to diabetes and of future heart disease and strokes and things like that. So that's another population of women, of people, women with pre-diabetes or gestational diabetes, which is just diabetes when you're pregnant, that you really want to be careful about. They really want to focus on reducing the chance of future development of diabetes.
Okay.
And it often happens at a similar age to the person that we're talking about now who's just had a body check, if you're pregnant in your 30s, for example.
Great. So you said it's great that this gentleman has gone and had his full body check. I think that is fantastic. I think what's less good is the way this information was fed back to him, because he just had a piece of paper that said pre-diabetes. Now, across India, there have been a lot of surveys and random blood tests to see how common this is. We know that in India, in the big urban areas like Delhi and Chennai and Mumbai, where the ICMR surveys were conducted, diabetes was there in around 11% of people, but a further 15% of people had pre-diabetes.
11% of Indians have diabetes.
Yes, 11% of Indians in urban areas, big cities, have diabetes, and 15% have pre-diabetes.
Wow.
And now what you said about gestational diabetes and this gentleman, I think the importance about trying to identify those 15% is because pre-diabetes is reversible.
Yes.
You can get yourself back into the normal blood sugar range if you do the right things at this time window.
Yep. I agree.
So let's talk a little bit about what you can do to try and bring that blood sugar down, because there are lifestyle changes that are very effective at doing this. So we're not going to talk straight away about medications, because there's really good data that if you engage with the right dietary habits, if you engage with the right lifestyle behavioral modifications, you can bring that blood sugar down.
Yeah. So I wouldn't treat pre-diabetes with medications. I think that there are loads of things, lifestyle interventions, just as we're about to talk about, that reduce the chance of you progressing to diabetes, and you can avoid taking tablets, or always considered to be a good thing. I think there is probably a role in the future for some medications which may have an effect on pre-diabetes.
Okay.
Maybe we'll touch on those at the end of the podcast. But right now we need to talk about what does this person need to do to reduce his risk of future diabetes and all the horrible complications that it brings.
Yeah. And on a general basis, it's no surprise that means eat healthy, move more. But the good thing about pre-diabetes and those recommendations are we have some specific interventions. So we can be more specific about what move more looks like.
Yep.
Now, going back 10, 15 years, we've had several studies that show these lifestyle changes can bring it down and bring down your HbA1c and bring your sugars back down into normal control. One of the first big ones was the diabetes prevention program, which took 3,000 adults in this pre-diabetes range and recommended to them 150 minutes of active walking. And that means zone 2 walking. For some people, that means walking at a pace where you can't maintain a sustained full sentence.
Right.
So 150 minutes per week, which means 5 30-minute brisk walks per week, brings that down over the course of the study period of a year.
So that's 5 times a week, 30 minutes. So basically every day, Monday to Friday, you need to do 30 minutes of exercise that gets your heart rate and your feeling that you can't breathe because you're exercising to the point where you can't complete a sentence. That's not no exercise, right? That's quite a significant amount. Obviously, the benefits are that you don't get diabetes, so it's worth doing. But you've just got to remember that if you're just going out for a walk around the block with your mates in the evening, that's not it, right? Like, that's not really high impact enough. People who say, I did 10,000 steps today, that's good, but did you do 10,000 steps that made you breathless? That's the question. And I often talk to patients and they say, oh, well, I do my exercise and then I get breathless, so I stop. And I have to remind them that the point of exercise is to get into that breathless zone, right? Like, that's why you're there. It's to feel like that. And you've got to feel like that for half an hour and stop. I don't see in Indian culture, and I'd love to hear people in the comments correct me if I'm wrong, because of course we're a bunch of British Indians, right? Like, what do we know about actual Indian culture? But I don't see exercise in the Indian cultural mindset. I don't see it as part of day-to-day living. You know, I don't see it as something that happens a lot. Do you think that that's something that would be really easy for a group of Indians to do that level of exercise?
Well, I think what I liked about this study was active walking is something that I am seeing more and more in relatives and friends in India. Yes, I haven't seen as much of the gym culture where people go and actively sit in a gym and do workout and in that structured way get that exercise intake per week. But active walking in parks in the morning is something that I'm seeing more and more often. So we're not talking about something that needs a gym membership or a real sense of pain to implement, but it does require an active mindset. You have to decide to do this. It doesn't happen by mistake. 150 minutes a week.
Okay, maybe they can do it. Yeah, all right.
And of course, the other side of this is you can't go and do your 150 minutes and then come back home and have a burger and chips, right? There is also a dietary component to this. And again, from food surveys, the individuals in India, unsurprisingly, that develop type 2 diabetes are the ones more likely to be having carbs. And processed carbs, white refined cereals are the real culprits here.
That's rice.
That's rice. Yeah. Cereal is the problem here.
Yeah. Okay. But in that study you were talking about, where people did 150 minutes of exercise over the course of a week, was there a calorie restriction in that one as well, or did they just eat whatever they liked and did they exercise?
It was a lifestyle change, but the specifics of the calories I wasn't able to see.
Okay, that's cool. All right, fine. But probably, I mean, I don't know if you've ever done any exercise. I know you have done exercise. It does make you want to eat differently after you've done it. It like immediately changes your mindset about your health. Because you feel healthy, suddenly you don't want to eat these things that you know are going to harm you. So I've noticed myself, and my patients notice it too, the exercise starts and the diet follows often. Yeah. And I think that's a good way around to do it, rather than starving yourself. Although that's another way to avoid prediabetes, right? Or subsequent diabetes. Maybe we'll talk about that in a second.
Yeah. I mean, the group in Madras who run the Diabetes Research Foundation have done some really fantastic work about what these dietary changes look like in the Indian diet. And they found that if you take the processed white carbs and just replace them with brown, healthier, complex carbohydrates, that alone would not be enough to bring down your risk of prediabetes. So it's not the type of carbs alone, it's the amount of carbs that these people who develop diabetes were eating. Yeah. So yes, you have to make the lifestyle changes to eat the right food, but you probably also have to have less of it or less of the carbs and replace that with fish, with your eggs, with your vegetables to be able to see the benefit of those.
So if you go from lots of rice to lots of chapatis, you're not really changing the amount of total carbohydrates. So we should talk about what's got carbohydrates in. So the rice has got carbohydrates in, plant-based, wheat-based stuff, cereals and stuff that you make out of atta and stuff like that. That's all carbohydrate stuff. Potatoes, loads of carbs. And then the things that have a bit less carbs are some of the other vegetables, fruits and legumes, cauliflowers, beans, those things. They've got some, but a bit less carbs. Things that have got very little carbohydrate, but have got lots of fat and protein in are meats. There are some really scary diets out there that kind of take what you're saying, a low carb diet, to a real extreme. For example, the ketogenic diet, which I think we should do a whole episode on one day, because I think it'd be really fun to talk about it. So you need to be careful that you're not doing really extreme stuff. When we were talking about this last night, I was imagining kind of a couple of extra portions of gobi which my mum made for me this weekend, and like one fewer roti would be how I change how I did my diet if I had to do that.
Okay. Yeah, and I think the reason this is important is because you've got a lot more vegetarians in India, and so simply swapping your white cereals for brown is not enough.
Yeah.
If you can't take meat to replace that part of your plate, you have to be more active and conscious about taking vegetables or fruit or other things to fill your stomach, so you're not reaching for the carbs late at night.
And of course, we know this is obviously not particularly relevant to India, but the rest of the world, red meat intake is also a real risk for heart disease as well. So like no one's advising going out and getting a big steak in or anything like that in this podcast, at least.
Yeah.
Okay, what else could they do then? So we've talked about exercise that reduces it. We've talked about carb restriction. You could calculate the amount of carbs. I think I've seen people talking about kind of 800 calories of carbohydrate. Okay. If you can work that out from how much food you have, and again, we probably need a whole nutrition episode to talk about that. That can reduce the amount of carbohydrates that you eat and can reduce your chances of progressing to diabetes as well. Anything else they could do?
Well, a lot more data has come out about surrogate markers, which are things that correlate with less activity with bad diets. And there's a nice study, again, that came out a couple of years ago that the amount of minutes you spend watching television is associated with your risk of diabetes. Okay. And so, again, these are lifestyle changes that in some ways we take for granted. But I think in this circumstance where this gentleman's just been given a report that says pre-diabetes, there needs to be more responsibility from the healthcare providers or someone to take charge of improving that individual's life.
Well, here we are. So it kind of boils down to what we say for young people, at least, at the end of all of these podcasts. There are some medications that later we could do, but lifestyle comes first. And in this case, there's good data to show that reducing your carbohydrate intake, maybe even down to a specific measure of around about 800 calories of carbohydrates a day, and increasing your exercise to 30 minutes of what you call level 2, but that's sort of slightly breathless exercise Monday to Friday. And you can do what you like on the weekend. Those have got good medical evidence basis for reducing the risk of future diabetes, both for people in pre-diabetic status and possibly even those with diagnosed maternal diabetes as well, or gestational diabetes. Of course, if you end up being diabetic because those things don't work or you're not able to achieve it, there's a whole raft of medications that are incredibly effective at keeping the risk down. Okay. And maybe that's another episode for us. But I think at the moment we're looking to wrap this one up, right? So that's the advice. Move more, eat less, but specifically 150 minutes a week and 800 calories in carbs. And hopefully that pre-diabetic status will be reversed and he can go find out, blood test in 6 months, see if he's made the number better. It's a great feeling when you do.
Yeah, great. I think we'll leave it there.
Thanks.
Thanks.